So, just at the beginning, I want to say thank you for this wonderful inputs. I'm learning again a lot this morning. We are making notes. Also for all the wonderful presentations up to now from Greg and from others. Wow. And as I mentioned earlier, we are busy revising the AU Plan of Action. And this will be reflected there in the new plan. Also what Doctor said the other day from Uruguay, we are really very happy. So I'm not going to be very long, but I just want to point out that whatever I'm saying is not sucking from my thumb. Much of it has been said again and again at our ministerial conferences on drug control. So these are the issues that I will just quickly touch upon. Drug trafficking, very quickly, just to say that the security threats to African countries associated with drug trafficking has been highlighted recently, and that there is some more violence going on in this trafficking exercise because the same networks also traffic arms, humans, wildlife products, etc. And it's about stemming the supply of drugs through law enforcement efforts rather than focusing on the health and social economic effects, which could pose a greater security threat. It exacerbates poverty in Africa. We are very much aware of that. Oops, what happened here? And people are fed up for some guys getting richer because of their corrupt activities, and even making it difficult because they inflate prices of houses through money laundered and even other productive assets such as cattle. People are talking about that, and people are fed up for that. And in order to combat it, the media and state assets should be employed to protect leaders who speak out against corruption, which is really the source of all these problems. Advocate Jo will definitely agree with me there. We know that large quantities of drugs are trafficked by sea, large consignments around the continent. Therefore, maritime intelligence capacity should be developed to identify and monitor the movement of vessels, which will take some time. There are some programs in that regard, but it will take time. Much more cocaine is coming into the continent, especially from Brazil. And there's been an increase in the trafficking of ecstasy from Western Europe, from Holland, and those countries. Precursor chemicals, we have the clear evidence that the precursor chemicals come from legitimate chemical outlets in our countries. So we need much more closer cooperation between law enforcement and these companies. The growing drug abuse among children, young children, there's need for effective coordination between the education, justice, health, and law enforcement sectors in our AU member states, which is not happening very effectively at the moment. And of course, the whole issue of counterfeit medicines. We know that in some locations, up to 70% of the essential medicines are counterfeit. We also know that the good ones, ARVs supplied by the Bill and Melinda Gates Foundation, are sold by corrupt government officials, and that the people don't get those drugs always. So these are real problems that we are having. We know the patterns of substance use across the continent, and we are really fearing that TIC may spread across the continent, and I can't see why it hasn't really spread yet. 34% decline in HIV infection rates in sub-Saharan Africa, but we also know that 34 countries are where we have people who inject drugs. And as Olga mentioned out yesterday, yes, in Africa we have very clear evidence that HIV infection and other bloodborne diseases are increasing among this group. And also for the other key populations, access to health services is a problem. Clearly, there are punitive policies and also stigma involved. And then we have a big problem, which was also mentioned yesterday, of pain management drugs, that 75% of our people die in pain due to non-availability of these drugs, many times not ordered through the pen system properly, or stringent prescription regimes. So we developed the African Common Position on Controlled Substances and Access to Pain Management Drugs already in 2012. This one is available. How well it is implemented by our member states is another question. What is the answer from the AU side? I mentioned the AU Plan of Action with 4 priority areas. The first one is coordinating the implementation of this plan of action at AU level in the regions and in member states. And we can say proudly or thankfully that 80% of our member states, of the 55, have dedicated focal points in drug demand reduction and in drug supply reduction, and that they supply us with information regularly. In the area of demand reduction, we have really done a lot. We've had a number of continental consultations, and we can say that 20% of our member states, which is not much, have some or other form of dedicated treatment services available for people who use drugs. Even in psychiatric hospitals, that's not the ideal, as was mentioned about Nigeria with the stigma, etc. But it is there, and we are happy for what we have, and we are really trying to improve on that. So we developed the AU minimum standards for treatment of drug use. We made it available for countries and organizations who really want to start or introduce these programs. That was done in 2010. Then we are also members of ISUP, where we, the international organization, where we train treatment professionals through the Colombo Plan with the support of the US government. The other 2 areas is, of course, supply reduction. We haven't done too much. We've had one continental consultation, and we know that around 90% of our member states have legal instruments in place, which are not always updated. When it comes to data collection, as you know, it's a big problem in the continent. So we have, at our continental consultations, we always invite UNODC to do some training on the ARQ to our member states. And then we established the AU Drug Use Epidemiology Network. We also support the other one in West Africa. We have assessed 5 countries earlier this year, and we will assess another 5 up to the end of the year. And hopefully by next year we will get solid epidemiology data from them, which will also help in our development and policy instrument, this plan of action for 2019. Just to say, in Southern Africa we have Angola and Zambia. Then we have Botswana and Zambia. We have Angola and Cameroon in Central Africa. West Africa, I can't remember. Senegal. Ghana and Togo. Ghana and Togo. North Africa, Algeria and Tunisia. And East Africa, Uganda and Tanzania. So we really hope that these will also serve as observatories for us to keep our eye on what is happening and to help member states. Yes, just to highlight about this African Common Position. It's been mentioned yesterday by Jamie. This one that was read at the UNGASS was the one adopted by the ministers. Unfortunately, our permanent mission in New York could put Minister Bokopani Zulu on the list earlier. So by the time Sudan read the one from the Africa group in Vienna, everybody was already asleep. So just to read one paragraph, so we got the hand, the ovation, as I mentioned on Monday night. Just to read one paragraph of this real forward-looking African common position that the ministers adopted. Treat drug use and drug dependence as a public health issue with socioeconomic causes and consequences, and that justifies health to be a separate fourth pillar in the international drug control architecture. People who use drugs must be offered support, treatment, and protection rather than be faced with punishment and a criminal record. This includes the provision of alternatives to arrest, sentencing, and incarceration. By that I say yes, in Africa, at the highest level, we are on the right track. And I'm very grateful for all the inputs of partners and people also in this room who has brought us there. So as for the 2019 political declaration and plan of action, Africa, as I said on Monday night, is ready to adopt a more health and development-oriented interpretation of the UN drug conventions, especially Southern, Eastern, Central, and West African countries, showing great support for prevention, evidence-based treatment, care, and harm reduction, and great support for civil society strengthened towards health, harm reduction, and development issues. North Africa is lagging behind. North Africa, there's a lot of conversion to be done there. Advocate Johan knows, and they are associating them, I think, more with the Arab states. Proposed way forward from our ministerial conferences, these are the statements made. Number one, if we want to really prevent and drug use spreading, we should use the same methodologies that we used for HIV/AIDS, which brought down the infection with 34%. That is, capacitate and strengthen national drug control bodies. And also, as David mentioned yesterday, perhaps really push for an autonomous body here, not linked to a ministry for that matter. National, regional, and continental observatories that we are trying to set up, including strengthening of current epidemiology systems, particularly monitoring drug use-related harm. Drug awareness raising campaigns, improve access to treatment for drug users, and back-to-work programs and other social protection measures for vulnerable groups, also to be assessed by those in recovery. Implement strong harm reduction responses. Implement the AU Plan of Action and UNGASS 2016 outcome with strong buy-in from the media and CSOs, etc., and scale up efforts towards combating money laundering, including asset forfeiture programs. It comes out again and again at our ministerial conferences, and then to provide incentives to schools, enterprises, government ministries, and the private sector that implement drug prevention and treatment programs. And lastly, in March this year, there was a strong call for smartphone applications to be developed for drug education and early intervention based on the African values of solidarity and consensus. Those two core values that Sean also pointed out would be so important in community participation. It's a wonderful strategy, and also to help those who need help, and for the community strategy. So we have the core values, we should just strengthen it and bring everybody together in implementing it. Thank you.